Dr. Strait, it's nice to meet you.
Nice to meet you.
My name is Matthew Strait. I'm a dual board certified physician in both emergency medicine and sports medicine at the Columbia University Irving Medical Center. As a sports medicine physician, I can care for any musculoskeletal complaint via my training in emergency department. We're used to seeing a lot of fractures, sprains, acute injuries, and in the clinic, I can continue to care for those injuries. We care for people in a lot of different ways and really try to get people back to the active lives that they would like to lead, whether that as a sports athlete or just caring for their daily activities. I was a very active hockey player, basketball, baseball, kind of played a litany of sports, and my family are all very active runners and athletes as well. So we dealt with more than our fair share of injuries along the way, and getting to bridge that gap, not only seeing patients in the emergency department, but also seeing them in clinic and really relating to injuries that they've sustained that I have also felt with back pain and ankle sprains, and getting to treat those things in the outpatient world in the clinic as well has been really rewarding for me, and I felt like a great confluence of both the care that I want to provide to patients in the emergency department, but also outpatient and continuing those treatments. Working at Columbia, the culture here is very collaborative, it's extremely supportive. As somebody who has split their time between the emergency departments and the Department of Rehabilitation and Regenerative Medicine, I have a lot of colleagues and I'm walking in several different areas, and everyone has been incredibly supportive and trying to ensure collaboration between the two departments and learning from one another so that we are constantly growing professionally and personally. I think I'm uniquely situated as one of the few hundred dual-boarded emergency medicine physicians and sports medicine physicians, and that allows me to see patients in the full range of acuity from the time of their injury, whether that be the sideline of a football game to the fracture that you're seeing in the emergency department for, or just in clinic with the knee arthritis that's been bothering you for years and you've never sought treatment for. Patients should know that when they're coming to one of our clinics here, they're not just going to be another cog in the wheel. They're going to be treated the same way as we would treat our closest loved ones and family members, and be involved in all the decision makings to make sure that when they leave our office on that day, they are fully involved and in agreement with the plan that we have moving forward. I've worked with professional athletes, Olympians, but that does not mean that you have to be Tom Brady to come and see me in clinic. If you rolled your ankle walking to the bus this morning, you can still come to my clinic and be seen and receive the same level of care that any professional athlete would see.